Welcome to Plus Talk on Plus Life, where we're all about turning positive into a plus. Some big decisions need to be made in a few days, so we thought we'd have a chat about what's at stake for those of us living with HIV. Joining me remotely is Karl Schmid. He's the Executive Director of HIV and Hepatitis Policy Institute in Washington, D.C. And here in the Plus Life studio, it's our good friend Jirair Ratevosian. You ran for Congress, you're a staunch HIV advocate, and you work in policy and academia. Thank you both, gentlemen, for being here for this conversation. Important times. Karl, I'll start with you. What is at stake for those of us living with HIV on the other side of November 5?
A lot. And it's just not people living with HIV. I think we have to look at the bigger system. And I think our whole government is on the line right now. Specifically coming to, people living with HIV, it's healthcare. It's access to healthcare. It's the Affordable Care Act. It's Medicaid. It's Medicare. And then when you look specifically at the HIV programs, it's to make sure those programs like the Ryan White program, the CDC HIV programs, the housing programs, that they're all, supported.
Jirair, when it comes to the candidates running for the top job, what have you heard from them that you think is positive when it relates to HIV, and what have you heard that concerns you?
Sure, Carl. It's good to be with you here, and Carl in D.C. I agree with Carl. This election is really a make or break for access to healthcare issues more broadly. I'd also say the future of Ryan White and the future of PEPFAR too. Big decisions are going to be made in the next 4 or 5 years that would really set the future for these important programs. With Vice President Harris and the Harris-Walz campaign, we've heard a lot about expanding Medicaid access. We still have 10 states that don't have access to Medicaid that haven't expanded Medicaid through the Affordable Care Act incentives. And that campaign is interested in giving more incentives to states to hopefully get more of them to enroll in Medicaid expansion, which are critical for people living with HIV. I'm concerned about what President Trump has said about repealing the Affordable Care Act. We've heard these old things come back up again. But of course, he said, there's no serious plans. He said he's got concepts of a plan. And I think that's really serious because lives are on the line. I think the Harris administration is committed to equity, is committed to advancing the rights of LGBTQ people. The other party seems to be capitalizing on marginalizing those of us that are LGBTQ plus or people who are living with HIV. It's been ugly to see what they've done to people living with HIV in Ohio and bashing Haitians for coming into this country and spreading HIV, according to the VP candidate. Those are very dangerous statements that we have to fight back against.
Yeah, Karl, where do you think things currently stand in Washington when it comes to the state of HIV in this country?
Yeah, I think we've been in really good shape with the Biden-Harris administration. They continue the program that we have to give former President Trump credit for in his team. Tony Fauci was very involved with the ending the HIV epidemic. We got some increases there. We got a concerted effort to end HIV. But the Biden administration came in. They amplified that program. Of course, we'd like to see further, increases, but it's tough times on the budget, and that's why we have to continue to fight. They reinstated the White House AIDS office, and first with a Black gay man living with HIV, and now with a Latino gay man living with HIV. HIV's been historically bipartisan, but I have to say the Democrats have been leading the way on this issue. Nancy Pelosi, Barbara Lee. It's become very partisan, and I think that's the work that we have to do.
And by the way, that's across the board. I want to go back to something you said, though, Karl, about Trump did get rid of the office for AIDS, the AIDS office in the White House. He got rid of that, disbanded it, and now we've got fantastic Francisco Ruiz in there. But is that a concern, Jirair, that if a Trump administration comes back in, he goes, hang on, cut that, don't need it, and how important is that office?
Absolutely, Carl. No, it is. It's a concern not only for keeping the ONAP office with that important representation that Carl was describing with leaders like Francisco, but also the Office of Pandemic Control. The Trump administration got rid of that office, and then we had a pandemic, right? And so the Biden administration has restored that pandemic. Actually, they've strengthened that pandemic office, which oversees the global pandemic response. But representation matters. These roles matter, including in NIH. The leadership in the Office of AIDS Research is important. If we don't have these leaders within and across the government, we're not going to keep HIV at the top of the list.
Let's drill down on the Affordable Care Act for a little bit, Carl. Just how important is the Affordable Care Act for those of us living with HIV?
So the Affordable Care Act is just fundamental, for coverage, for treatment, and we can't forget prevention as well. But also the ACA just sets up parameters, cost sharing limits. You cannot spend more, used to be no out-of-pocket maximums. Now, at least we have those protections. It's also important for Medicaid. And, before, a person who was low income, they couldn't get on Medicaid if they didn't have full-blown AIDS. People have forgotten that. We become accustomed to what the Affordable Care Act has done. Now it's based on income. So anyone below 150% of poverty level. I should also say that premiums for the private insurance market used to be configured based on your healthcare status. So if you were living with HIV, you had to pay more money. Now you can't do that. So there was just, and then of course the coverage of preventive services. And PrEP is really important for preventive service.
Right.
But what about HIV testing, hepatitis testing, STD testing, mental health screening? Those are all free. Colonoscopies too. You should get those as well.
Oh, I just had one the other week.
Those are all free now because of the Affordable Care Act, and also, the non-discrimination provisions. You cannot discriminate. They are not supposed to be doing those things. They're supposed to be covering the drugs that are on the treatment guidelines, not putting all the drugs on the highest tier. And so now we come into the enforcement side, but at least we have the law in place.
Right, now we do, Jirair, but if one candidate takes office, and if we're led to believe everything that we hear out on the campaign trail and from both sides, we could lose all that.
Absolutely. And these are not just concrete policy provisions that Carl is articulating. They're lifelines for people living with HIV and those who can benefit from prevention services, for example. When you look at the states that have expanded Medicaid and those that haven't, there's a direct correlation between how we're doing on the HIV response. The 10 states that still haven't expanded Medicaid access, Texas, Georgia, Alabama, Tennessee, to name a few, they still have growing HIV epidemics. People there don't have access to PrEP in the way that we do here in California or in Washington, D.C., and that is a disparity because that means black and brown people are not getting access to care.
And we know that that's where the rates continue to climb. You've both mentioned funding programs like Ryan White. If funding gets cut to such programs, what does that mean for the average Joe living with HIV?
It's a scary thing, and this has also happened already. House Republicans in this past budget cycle proposed over $700 million in cuts to the Ryan White program. They gutted the Ending HIV Epidemic initiative that President Trump started, and they've also, things like the Minority AIDS Initiative. They've proposed massive cuts to that at a time.
The housing situation, the program for
HOPWA,
yeah.
Exactly, and this is when housing prices are out of control, when people need access to these services. It means people fall off services. It means people don't get PrEP. It means people's health insurance discriminates them. It means more HIV infections. It means people die.
Can I add to what Jirair just said? So I agree with everything that he said, but we shouldn't be talking about cuts. Obviously, cuts are going to hurt the people who get the services today. But remember, there's several 100,000 people living with HIV in the United States that are not in care. And we need more funding to make sure there's the states and the clinics can get those people on care and on treatment. And let alone, we want a PrEP program as well. So we should be increasing our funding.
So we're talking about treatment, access to treatment, things like that. What about when it comes to the ongoing funding for research and vaccines and finding a cure?
Yeah, I'm glad you brought up treatment too. And research as well. because the NIH is under assault as well. There are, it was interesting that, the last administration, Trump would put increases for HIV funding, but at the same time, he was proposing cuts to the NIH, which would have been devastating to, we still need a cure, and a vaccine. And I don't know what's going to come first, but it's going to take a lot of time and a lot of money.
Jirair, why is it essential for those of us living with HIV to really be paying attention between now and November 5th? And if we are afforded the privilege to be able to have a say, to step up and have that say?
Absolutely. We have to be part of making our government work better for all of us, Carl. We, not only for protecting and expanding HIV services, Ryan White, Affordable Care Act, all the things that we are talking about today, but to improve our democracy, to protect our fundamental freedoms that we all have. There's a stark difference between one side of this campaign and this election that wants to protect our fundamental freedoms and the other, and Republicans who want to take us back to 1901. I wasn't here for 1901, but I don't know why they're so obsessed with going back 100 years. And we're not going to go back. And I think we have to be part of that democracy building process. We have to show up in the halls of Congress. We have to keep HIV on the radar, because one thing we haven't talked about is like Mpox, for example. There's a lot of other competing priorities that our government is trying to respond to, crises around the world, 2 massive wars that we're fighting right now. Those bills are going to be due in the next few years, and they're going to come and cut the HIV programs to pay for those bills, and that's where we have to stop them.
I want to try and finish out on a slightly positive note, gentlemen, if we can, and I'll start with you, Carl. What assurances do you see from Washington, D.C. that HIV is still a priority and will continue to be a priority moving forward?
Yeah. So, I think the Biden, the Harris-Walz team, and you look at the Democratic platform, HIV is a priority. Kamala Harris, put forth a very strong PrEP bill when she was in the U.S. Senate. So I think, we can be assured that HIV is going to continue to be a priority. But as Jirair said, there's competing interest, even on, that side of the aisle. Like, it's true. There's a limited budget, and there's a lot of other issues out there just in the healthcare space, let alone all the other things going around the country and around the world. Now, the Trump administration did put forth, an ending the HIV epidemic initiative. And I hope it's going to continue. I would say, we don't know what the election's going to bring. There's still going to be a lot of Republicans in the Congress, and they may control 1 or 2 chambers. We have to work with them.
Jirair, I'll give you the final word.
Well, thanks. I'm not as optimistic as Carl. I want to be optimistic, but I think the issue that we have in Washington is that people are being elected to go there not to actually find solutions to some of the challenges that we have. Not only on healthcare issues, but issues like immigration, issues like gun violence prevention. We have to get back to the kinds of politics we had where differences doesn't mean division or doesn't mean hatred, and I think we can get there, but HIV advocates, people living with HIV, LGBTQ advocates, we have to be part of making that government work better for all of us. I'm optimistic we can get there, but the state of Washington now has some real dark consequences for the future of HIV if we don't insert ourselves and make it and elect all the right people to help advance the issues, get more funding, and protect our rights.
Yeah, all the more reason why, if you are afforded the privilege, to step up and have your voice heard. Karl Schmid, always lovely to meet another Carl down the line. And Jirair, thank you so much for joining me for this important topic. That is going to do it for this episode of Plus Talk. If you want more information, visit the website, pluslifemedia.com. And remember, we're across all your favorite social platforms at Plus Life Media. Until next time, be nice to one another. If you have the chance, go out and vote. We'll see you soon. Bye-bye.